evening and welcome to Pharmacology Affairs. Today we're speaking about hillbilly heroin, also known as oxycodone. This drug has become one of the most widely abused prescription painkillers, with numbers highest amongst those using it non-medically. In Australia from 2005 to 2013, a study showed an increase of 17% in those injecting the drug. Of those who were using it for pain relief, 86% said their prescription became the problem. The US alone consumes 80% of the world's oxycodone, which contributes to the highest number of drug-related deaths, with numbers reaching more than 5,000 just between 1998 and 2005. And now we go live to our reporter, Rokaya Nabum.
So when is oxycodone actually prescribed?
So it's a strong opioid that is used to treat moderate to severe pain caused by cancer and non-malignant pain as well as post-operation. It has adverse side effects including sedation, respiratory depression, nausea, pruritus and constipation. It also has a high risk of abuse due to its nature as a Schedule II narcotic drug. Long-term use can lead to dependence. People can obtain oxycodone by either oral form or as a form in oxycodone hydrochloride, which is used to inject inside a patient.
Under the Pharmaceuticals Benefits Scheme, oxycodone is a Schedule VIII drug. Doctors must follow state and territory laws when prescribing oxycodone and must notify or receive approval from the appropriate health authority.
This is done by illegally obtaining prescriptions from family and friends as well as drug dealers. Prescription shopping by consulting with multiple doctors to feign sympathy. But what has alarmed researchers is the growing trend to shop online for legal drugs.
An alarming concern is the abuse of oxycodone by illicit drug users, as the tablets can easily be crushed and snorted or injected for a faster high. However, new oxycodone formulations to address this issue have been created, which include an uncrushable tablet, limiting its potential for abuse. But what we need to remind ourselves is that oxycodone is not just affecting drug addicts. They're normal people getting their pills from doctors, and GPs need to be comprehensively trained in assessing chronic non-malignant pain as well as assessing addiction. But yeah, these patients do need to be educated on how to use this drug, as well as be monitored every 2 to 3 weeks for their condition as well as for their psychological well-being.
University Associate Professor Ken Rogers will now be discussing the mechanism of action of oxycodone.
So today we'll look at the effect of oxycodone at the synapse. Oxycodone affects synapses in the spinal cord, brainstem, thalamus and cortex of the brain in both presynaptic and postsynaptic membranes. At the presynaptic end, oxycodone agonizes the mu-opiate receptors attached to a G-protein coupled receptor. Binding to this receptor causes GTP to be converted to GDP on the G-protein complex, inhibiting the action of adenyl cyclase, meaning that ATP cannot be converted to the second messenger, CAMP, decreasing its levels. This causes an increase in the levels of pKa. Increased pKa levels affects calcium and potassium channels, whereby calcium channels close and potassium channels opened, thereby causing the hyperpolarization of the cell. The cell hyperpolarization also affects the release of endogenous calcium, meaning no neurotransmission can occur from the cell. This means that excitatory neurotransmitter release such as acetylcholine, norepinephrine and serotonin in the synaptic cleft is stopped, thus stopping nociception. At the postsynaptic membrane, oxycodone also binds to mu receptors in the same way and causes hyperpolarization of the postsynaptic cell, resulting in a further decrease in pain transmission. Oxycodone also affects the thalamus and limbic system, altering the emotional assessment of pain, causing dopamine and serotonin release, thus activating the reward pathway of the brain, causing addiction and dependence for the drug.
It has been recognized that oxycodone shouldn't be used as a first-line treatment for chronic pain. This is due to long-term use lowering the threshold to pain and causing tolerance. Alternative therapies are being investigated, and psychotherapy alongside drug treatment is recommended to reduce the psychological impact of chronic pain.
If you or a family member are experiencing an addiction with oxycodone or any other drug, please call our helpline or go on our website for any more information. Thank you for joining us. Come back next week for another episode of Pharmacology Affairs.